So have you ever had influenza or the flu? If you have, were you diagnosed by your symptoms or did they actually test you for it? Because if they actually tested you for it, you will have experienced what I'm about to demonstrate to you today. Now, if you haven't ever been tested for the flu, what I'm going to demonstrate will give you an idea of how that's going to happen if you go into an office to be tested, or even urgent care for that matter. So by knowing how a nasal swab is obtained to detect the influenza virus, hopefully will reduce any anxiety that you may have in having it done. So according to the Centers for Disease Control, influenza or the influenza virus is a respiratory illness. It's contagious. It affects the throat, the nose, and sometimes the lungs. It can be very mild to severe, and it can even cause death. It is not a cold. There are symptoms that are similar to a cold, but the flu virus, you have chills, fatigue, aches, you have a sore throat, runny or stuffy nose. Sometimes you have vomiting and diarrhea with it too. So as far as being contagious, the droplets, the spray from you coughing or sneezing, those are the droplets that are the contagious part. If people are in your vicinity when you cough or sneeze, those droplets actually travel pretty far. And if they're close by, they can actually inhale those or get them in their mouth or nose, and then that can cause them to get the flu. Now, as far as being contagious, if you get the flu, you can be contagious a day before you actually have the flu, up to 7 days after becoming sick. Okay, so a day before to up to 7 days while you're sick. Okay. Other risks that can happen for people that get the flu, some people it affects them so bad that they can get bacterial pneumonia, they can get sinus infections, different things like that. But people with chronic illnesses, they can have worse problems with their congestive heart failure, for instance, or for their diabetes or their asthma. So people really need to be careful, if they start having symptoms, because the flu is nothing to mess with, and it needs a proper diagnosis. Okay, as far as medications and things, there's antivirals out there. They don't kill the virus. They just help reduce the amount of time that you might be ill. And it doesn't work for everybody. It's still important to know if you actually do have the flu or if you have something else going on. Because if you have a bacterial infection, it's important that they give you antibiotics for that. Okay, so now, how do we test for the flu? Well, I have out here, according to UConn Health, they have things that they recommend that you have. They call it personal protective equipment, or PPE. So I have gloves, I have hand gel, which I'm actually going to put on my hands right now so that it dries before I put my gloves on. I also have a mask, a gown, I have something to put the swab in after I take it so that I can either do the test in my office lab or I can send it out to another lab. And then the actual swab that we'll be doing the test with. Now, because of lack of a volunteer for me to do this, I will be demonstrating this on myself. So this could be kind of interesting. When you're in an office and you are going in to have a nasal swab done to determine whether you have the flu virus or not, they should sit you in a position where you can't jerk your head back. So hopefully they have the exam table up high enough that you can't jerk your head back or forward, because you don't want that swab to go farther than it needs to go, because it will not be pleasant. Okay? And then what they should do next is if you have a runny nose or any mucus in the facial area, they should be asking you to wipe it off or to take a Kleenex and blow your nose or do whatever to reduce the amount of those yucky droplets, because you don't want to give the flu to anybody. So me as a healthcare professional, I will do anything that I need to in order to protect myself. If you're really gooey, I'll wear a mask. I may put a gown on. I may have goggles on even over my glasses. So because I don't want to get the flu. So I have gelled my hands. So that's something that your person should do before they go to put a pair of gloves on. And they should definitely be wearing gloves to do this. Okay, and then what they will do is they will have you tilt your head back, and they will take the swab, and I'm going to turn sideways here, and they will have you tilt your head back, and they will take that swab, and they will very gently put it in your nose, and if they do it right, it will go right into the back of your nasal passage, and then they will feel resistance. When they feel resistance, they will twist it several times, and then they will pull it out. What they're doing is they're getting the cells from back in your nasal passage that will determine whether you have the flu or not when they do the test with it. Then they should be putting it in something to take it out of the room, so that they can go do the test, or so that they can send it away to be tested. They'll make sure that you're okay, because sometimes that can make your eyes water and all that, those kind of things. So they'll check you for that, and then they'll leave you in the room for the provider to come in, or they'll tell you you can go, just depending upon the situation. So that's the extent of it. That was a nasal swab. If you didn't know what happened before today, now you do. It wasn't real uncomfortable. In fact, the swab is so fine that it kind of tickled a little bit. So knowing how the nasal swab is actually done to detect the influenza virus, hopefully will make you less anxious if you ever have to have it done. It's quick, it's easy.